Okay, so today we're going to talk about pulmonary embolism. And this is another disorder that's kind of classified under respiratory disorders. You learned about in adult about a deep vein thrombosis, but what a pulmonary embolism is it is a blood clot that is blocking the pulmonary artery. And so think of it like a lung attack. So, you at this point, you've learned about a heart attack. You've learned about blood clots like strokes, blood clots in the brain. You learned about blood clots in the legs, but now we're going to talk about blood clots, what happens when they get in the lung. So this is called an embolism, which means like these don't usually start in the lungs. They travel to the lungs from somewhere else. So the patient might have had a DVT. They commonly atrial fibrillation is a common cause of a pulmonary embolism. They could have a fat embolism from a fracture, or they could have a tumor. Risk factors, of course, are going to be being immobile, I'm having long bone surgery like pelvic or lower extremity surgery. I'm having a history of a blood clot, of course, cancer, obesity, people that are on oral contraceptives and hormone therapy. So I always tell the story of my friend who was, she was in her like mid 20s, one of the healthiest people I know, like marathon, triathlon kind of healthy, very, very in shape. But she's on oral contraceptives and, I guess maybe some sort of genetic factors too, and she ended up getting a pulmonary embolus and having to get treated on anticoagulation for a period of time for that. So it can happen. I know these things seem like, oh, that's never going to happen, but these things do happen young and old. So you always need to know the risk factors. Pregnancy puts you at higher risk, cigarette smoking, and having a clotting disorder. So, what does a patient with a pulmonary embolism look like? Well, usually a lot of the telltale symptoms are going to be that they can't breathe, they're breathing super fast, and their heart rate goes up, and it's usually pretty sudden. They can also have chest pain, and they could have a bloody sputum as well. If it's a really, really bad pulmonary embolism, they can even have a sense of doom. They could say something's not right, a severe hypotension, and a change in their mental status all of a sudden. That's definitely the sign where you're like, okay, this isn't good. So, how are we going to diagnose this? What we're going to do is we're going to get a couple different tests. We're going to get what's called a D dimer. And if you remember this test, you might have learned about it when you were an adult. A D dimer tells me that somewhere in my body there's products of a clot. So, most likely I have a clot somewhere in my body. It doesn't tell me where it is, it tells me somewhere. And so I can't use this specifically and say, oh, the patient has a PE just based on that, but it can help me with other tests. So I need to look specifically to find out where this clot is. So to specifically see if there's a clot in the lungs, I can do what's called a spiral CT or a VQ scan, which is a ventilation perfusion scan. And both of these can actually show me the vasculature in the lungs, kind of like this is a picture of one. And you can see where, like on this side, there's lots of oxygenation and flow here. There's the dye going in over on this side. The dye is definitely not there. And so there's something that's not working effectively over on this side. So look at these things. These are pulmonary embolus that came out of someone's lung. Look at how big they are. So of course, most people are not going to have them this big, but look how big they can get. That's pretty scary, right? Imagine if that was in your lung. That's going to be hard to breathe. So how do we treat this patient? We're going to do oxygen therapy because obviously this is going to literally block the blood vessels that are supplying your ability to adequately oxygenate. They're going to need respiratory support. They may need to be ventilated, just depends on how severe it is. Turn, cough, and deep breathe and incentive spirometry are going to be key. We may use fibrinolytic agents, and that's talking about medications that are clot busters like TPA. We'll most likely use some sort of anticoagulation therapy. They'll get IV heparin or low molecular weight heparin. And a lot of times they're going to be sent home on Coumadin. Like my friend that had the pulmonary embolism, she was on Coumadin, I think, for 6 months after her pulmonary embolism. We're also going to do pain management because this is uncomfortable and they can't breathe. They may have some anxiety and they can get surgery. There's some surgical options. They can get an embolectomy, which is effectively this, where they go in and they actually pull the embolus out. And then they also can do what's called an IVC filter, which pretty much, tries to, if they have like someone has like a lot of blood clots in their legs, they have a clotting disorder and they're always getting blood clots in their legs. What this is effectively, it's a filter that stops tries to stop, like, pretty much think of it like a net that gets put in your blood vessel in your leg that catches clots. So it doesn't stop you from forming blood clots, but it stops them from traveling to places that could be deadly. There's a lot of, trouble with IVC filters, and you don't see them inserted very often unless it's a very severe case because, again, you have a device in your leg that's just holding onto a bunch of clots. It doesn't, it's not necessarily always desirable. So what's my role as the nurse for a patient with a pulmonary embolism? I want to keep their head of bed elevated in order to help support their oxygenation and their breathing. I'm going to monitor their respiratory status and oxygen levels closely. I'm going to monitor their labs for anticoagulation therapy, and I have a separate PowerPoint over anticoagulation therapy, so feel free to watch that if you want to learn more about that. These patients are all going to be at risk for bleeding because they're going to be on medications that are going to put them at high risk for bleeding. Anyone who's on anticoagulation should be on bleeding precautions. So I'm going to teach them, what kind of monitoring are they going to need long term if they go home on warfarin, et cetera, and what are bleeding precautions. So, this just kind of goes over some of the major highlights. Someone who's on bleeding precautions, they should use electric razors only. They should not use straight razors. They should not be on aspirin or NSAIDs because that'll increase their chance of bleeding. I want to try to use small gauge needles whenever possible because those large needles can definitely what do you call them? Put them at risk for obviously, it's like just another opportunity because we're trying to, as a whole, protect from injury and avoid trauma. I want to decrease the amount of times I have to stick them. And when I do have to stick them, I don't want to stick them with the biggest needle possible because I really want to try to prevent them from having a high risk of bleeding. But this patient shouldn't be doing contact sports. They should avoid, things that can easily result in injury. And yeah, I'm just going to need to keep a close eye on them when it comes to any bleeding that I find in their assessment. Their gums, their nose, their stool, their urine. I need them to watch out for that, and I'm going to need to look out for that too. So we also want to enforce how can we prevent pulmonary embolism. So making sure that while they're in the hospital or mobile, that they're on DVT prophylaxis, and then encouraging mobility and hydration. So remember that Virchow's triad. We're thinking of all the things that cause you to form blood clots. So we want to try to decrease those. And then if they're in atrial fibrillation, we'll want to manage that abnormal rhythm. And the more the getting them back to a normal sinus rhythm will increase their chance of or it will decrease their chance of, forming clots and then, ending up with a pulmonary embolism. So, but it will increase their chance for better outcomes, I think is what I was trying to say. But as a whole, so if they're in atrial fibrillation, I want to try to convert them or at least get them down to a slower rate where they're not going to, be maybe throwing clots so easily. So that's pretty much pulmonary embolism in the back. Definitely makes you maybe wanted to not get this yourself. So, keep your fluid intake up and make sure you're moving around as you're watching all these fun videos. So I'll see you next time. Bye.